Hi, what an honor, a privilege for us to talk together on a very, very important issue that has to do with you as a lady and also as a guy. When it has to do with knowing the ovulation time of your wife or even yourself. Because you see, I used to think that the issue of abortion, which most people say unwanted pregnancy or unplanned pregnancy, and I thought is the problem of only the singles. But I was amazed in the course of practice that many married women will use abortion as even a means of family planning, which is a horror. The demonstration of ignorance to the extreme indeed, and by the reason of this very passion, I want to show you something in the reproductive program of a woman, which of course I could say that God has provided for you. To know when they use the word, they say, my safe period and my unsafe period. At what point will my ovulation come? At what point will I get pregnant? I do hope it will be a delight for you to know. Now, take this. Every woman has menstrual cycle. But something that is not very clear to most women is that they fail to realize that you have a range of menstrual cycle which differs from one woman to another. So you can't use the ovulation time of another lady to calculate your own. No, you will get it wrong. You will get pregnant at the wrong time, or you may even not get pregnant as you are hoping to get. You get that hard. Now look at this. In the real menstrual cycle, it has been studied and found that there is a normal menstrual cycle that ranges from 21 days to 35 days. I will give you again, 21 days to 35 days. That implies if your menstrual cycle, what they call menstrual cycle, at the point you saw your menses today, the next time you see it again, at a time between that and the next one, you calculate it, it could be 21 days, some persons 28, some persons 30, all to the range of 35 days. Averagely, most women do see their menses 28 days, but that does not mean that a person whose own lower than that, 28 up to 21, and somebody who gets up to 35 is also not a normal woman. Perfect and good, that range is okay. Now, what does this hold when it has to do with ovulation period? Ovulation period is the time of a woman to have the capacity to get pregnant if she has intercourse on that particular season. It's rather you call it ovulation period because of the range around that particular axis which can give the woman opportunity to get pregnant by God's design. Now, you can hear some women, they will say, I am not safe. I don't know whether it is from Boko Haram or whether from militants or their safety. You begin to wonder, what is it? Is it that they are not safe of what? And you will hear them say, this is my safe period, this is my unsafe period. She is just trying to say, this is a period I might not be able to get pregnant, this is a period I am likely to get pregnant. And that is the time of ovulation. How do you then calculate? Seeing the variety, seeing that the time varies from one woman to another, so many women have been in confusion. They don't know who will give them the right direction. But I am here, out of passion, to show you how you can do that. To make you live a more healthy life, preserve your womb. Because so many women have already gotten their womb damaged by reason of unnecessary attempts on abortion and all the complications associated with it. Okay, first of all, you need to know your menstrual cycle. How many days is it? If you have not done that, start to do that now. Monitor your next 3 months. I will open up my line, even if it is to chat along this very line to guide you. If you start it off from today, if your menses comes today, you will record it day 1. And when it comes again, you record it. You calculate it from that day 1 to the next time you saw it. You know that is your cycle and you calculate. Now, it's a little mathematics. Apart from other science, I will show you the little mathematics on how to know the day of your ovulation. Now, you will be in position to look at it this way. When you know your menstrual cycle by this calculation, your own ovulation period will be this mathematics. Take in your mind 14. It's a constant mathematical factor we are going to use right now for you to know yours, which is different from the next person. Now, if you know your own menstrual cycle, you just have to say that your menstrual cycle minus 14. Whatever you get is your own day of ovulation. Now, let's calculate it. If you have 28 days cycle, you know that it's 28 days now. You can now say 28 minus 14. What is it? 14, isn't it? That is to say, you will ovulate if you start from day 1 to count. 1, 2, 3, 4, up to 14. You are likely to ovulate that particular day. That is your ovulation day on the 14th day. Now, what about a woman whose cycle is 30 days? We still have the same factor, 30 days minus 14, that should be 16 days. So counting from day 1 up to 16th day, that woman is likely to ovulate. Alright, what about a woman that her own is just 21 days? Very short cycle, isn't it? Now, it's the same formula also applied. 21 minus 14, that's 7. This lady is likely to ovulate very close to the period after her menses. If she bleeds for 3 or 4 days, the next 3 days she may begin to ovulate. But why doesn't she have a knowledge of that? Soon after ovulation, she can get pregnant. But if she begins to follow those people whose own is 14, those whose own is 28 days, and now gets to 14 days and hoping to get pregnant, her ovulation must have passed. So, same thing applicable. If yours is 26 days, you know what you will do. 26 minus 14, that gives you 12. So, your ovulation is on the 12th day. That is to say, whatever you have minus 14, count it from the beginning. That day, you would ovulate. I think it is interesting, okay? For those that have not been able to know their ovulation time, it is important for you, first of all, the next 3 months, begin to check time that you see your period. When it stops, you mark it. You see the next one, you mark it. You see the next one, you mark it. Then you can sum it to say, my normal menstrual cycle is this or that or that. If you can't question, you can get in touch either by WhatsApp or whichever means, and we could be able to guide you to give you the maximum protection. God made you a woman, and you have a protection from the so-called unplanned pregnancy for you not to be a victim of abortion and the complications. Joas Medical Diagnostix is available to offer you. Now, some people may have irregular menses as a result of maybe polycystic ovarian problem, or maybe as a result of hormonal or other reproductive factors that also can be defined by reason of you having a contact with your doctor, and he can be able to help you correct such an anomaly. Okay, so you can have something that is more regular as other women. Now, there are other signs apart from the issue of you making this calculation. There are other changes in a woman's body that should tell whether this woman can get pregnant or whether she is seeing ovulation or not, and that has to do with the issue of cervical mucus. Now, let me tell you, if you put your hand in the vagina, you will meet a structure that is like the tip of the mouth. It is called the cervix. There is usually something like catarrh that usually covers that place, so the sperm or whatever infection may not go inside. Okay? Before ovulation, these catarrh-like things called the mucoid plug, they used to be thick. So it is very difficult for anything, including the sperm, to go in there. Now, towards ovulation, you will see that that particular catarrh-like thing will turn into something like ochre. You know, when you put ochre, it will just be very smooth, very light at that particular point in time. It is significant that you are now ovulating. You can have a look at this picture. This is the cervical mucus. Before, when there was no possibility of ovulation, you can see how free this other one is. That is the different stages and what you can get during ovulation. But that very sign, if you know some women may or may not at that point, you may look at all these other calculations we have made. So others can have a kind of changes in their body temperature. That time they will become a little warm. Some people will say, my breast is very heavy, and all that and all that. Individual variation could be there. So if you don't have such thing, don't begin to say, I am not ovulating. However, in worst case scenario, you say you are confused. I don't know how you go about it. You have to consult your doctor so that he will be able to guide you nicely. That will help you, because wisdom is profitable to give you direction if you lack it. You will be a victim of life. That is why this message is very essential. Learn it, share it with other people, and take advantage of it. Nevertheless, God did not provide it for abuse. He made it for you to live a more healthy life. God bless you as you share it.